How you doing? Welcome to Private Talks with Anthony. Today we're going to be having a conversation. If you're new to the channel, tune in. We have mental conversations that are going to be able to help you and benefit you for the long run and for your personal development journey. But however, today's video is going to be about exploring different therapy modalities, finding the right fit for you. When it comes to therapy, there's many different styles, and it's catered for you because you are the client, you are the priority. So I want you to really recognize that there are different styles out there. So in this video, I want you to really tune in to understand the importance, essence of mental health, therapy, and then different styles as well. So first, like I said, we'll start off with the need when it comes to therapy and its essence of why it's important. So mental health is just as important as your physical health. So it's not just about working out in the gym, getting that the best physique or the best body that you want, but it's also making sure you take care of that brain in there. My sister said the same thing to me because I was just going to the gym, just taking care of my body, just really focusing on, like I said, the external, but not really focused on the internal, what's going on and stuff like that. So once I got a therapist, it really helped me get more insight, more awareness, and it really helped me accelerate when it comes to my personal development. So I want you guys to understand the significance of mental health. Moving forward, therapy can also help when it comes to your stress, anxiety, trauma, relationship issues, and even the personal growth. Just like, you know, you're going to your doctor and you're getting your physical checkup, it's finding the right therapist is just as essential, you know what I mean? So therapy is the key, and finding the right strategy in style is key as well, right? So in today's video, we're going to be diving into all those type of things. So I want to start off with, like I said, our common modality, different therapy styles, and we're going to jump right into our cognitive behavioral therapy, known as CBT. CBT focuses on identifying and changing negative thought patterns that affect our emotions and our behavior. If you're struggling with anxiety, CBT can help you recognize irrational fears and replace them with more realistic thoughts, right? So if you're self-sabotaging, you're pulling yourself down, and you're also in an environment that is pulling you down, you're not really recognizing what's going on, this style can really help you gain some more self-awareness of those negative patterns, negative thoughts, and really have you get to where you need to be by rational thinking, right? So I want you also to take this in consideration because this is a really worldwide strategy and therapy style that is used, right? So in a 2018 meta-analysis found that the CBT leads to long-lasting improvements, especially when combined with other treatments as well. So like I said, this is a really good, useful tool to really help you get some more insight on your awareness and your thought patterns. The next is going to be psychodynamic therapy, which is an approach that is based on the idea that of unconscious thoughts and past experiences that shape our current behaviors and relationships. So when we're just doing stuff irrational and we're just acting and just, it's affecting our reality, this style really helps us understand like our patterns, what we're doing, the unconscious thoughts and stuff like that, because we may not recognize what we're doing because we're just so used to being in our ways and being in our patterns. This style helps you gain some more insight. So it helps you work with and uncover your unconscious patterns, as I just mentioned, and understand the influence and the impact of what's going on, right? Studies show that psychodynamic therapies increase, your self-awareness and improve your emotional regulation, which is key, right? In addition, in a 2017 study, we found that this therapy intact is particularly helpful for individuals working with long-standing issues. So this could really be beneficial for the long run. Moving forward, I want to talk about dialectical behavioral therapy, known as DBT. DBT is a blend of cognitive behavioral techniques, as mentioned, with self-sabotaging thoughts and all the type of stuff like that. So it's mixed with a little bit of that, with mindfulness and acceptance strategies to really help us, have that self-compassion. For those out there that have something like borderline personality disorder, this is a useful tool or therapy strategy. So research shows that DBT can reduce self-harm behaviors and improve emotional regulation. Moving forward, DBT significantly reduce suicidal behaviors and hospitalizations for people with borderline personality disorder, right? So this is a really useful tool to really, like I said, help people that are self-sabotage or even have risk use behaviors of self-harm. So those out there that are experiencing some of these thought patterns and this darkness, or going through it with irrational thoughts and fears, this is a useful strategy as well. I never want you guys to make it seem as if that these thoughts are not significant, or you're crazy, or this or that. I don't want you to start using those misconceptions or this harmful language when it comes to your thoughts, because these are your realities. So I want you to take it into consideration, and like I said, utilize the services and take these therapy styles for its benefit for you, right? So just moving on into our conversation is going to be, the next is going to be humanistic therapy, right? So humanistic therapy focuses on personal growth and self actualization. So really finding that the self essence of yourself and really reaching your full potential by who you are, and focusing on your growth in that journey. So humanistic therapies believe that everyone has the potential to grow, and creating a supportive, non-judgmental environment is essential for that growth. So they're going to be able to provide a conducive environment for you, just like the other therapies as well. But this really focuses on who you are, where you're trying to go, where you're trying to be, your purpose, all those type of things, the essence of who you are, and they're going to provide that support when it comes to this therapy style, right? So in a 2005 study, we found that humanistic therapies like person-centered therapy are effective for building self-esteem and promoting personal growth. If you're looking for a therapy that is able to help you become the best version of yourself, or become, help you become more authentic, this is the humanistic therapy might be the best fit for you to help, like I said, reach the essence of who you are and get more discovery, right? Moving forward, we have EMDR, which is eye movement desensitization and reprocessing. So this is a different type of therapy, which is kind of cool. But when it comes to EMDR, it often is used for trauma recovery. So those that are involved with, the stimulation of the eye movements, this therapy style basically is allowing a therapist to kind of look at your eyes, and as you guys are having this conversation, and really kind of see what the trauma is. This is a really new kind of, not new, but it's been out there, but it's an interesting, more intuitive type of treatment, right? So when it comes to research offers that EMDR has shown great promise in treating PTSD. In a 2013 study, we found that EMDR was highly effective reducing PTSD symptoms for those out there, and often in fewer sessions than traditional talk therapy. So this is a therapy style that's able to help those that went through traumatic experiences, trauma, and really help you reduce those anxieties in this type of treatment. So if you want to be able to see what this has to offer and what this may look like, I would really suggest you to reach out to clinical offices and support systems out there to get some more insight on this type of treatment. But like I said, it uses the eye movement desensitization to really assess that trauma and help you get to where you need to be. Lastly, I want to jump into couples and family therapy. So if you're dealing with relationship issues, you're dealing with couples and family, like support that you may need in regards to your situation, this could be a useful strategy. So when it comes to these therapies, it focuses on improving communication, resolving conflicts, and even strengthening connections. So when it comes to those romantic relationships, even those family situations, this is going to be able to help really cater and focus on this type of situation for you, right? So when it comes to research, we have a study that was able to show that couples therapy improves communication, reduces distress, and boosts satisfaction in both short and long-term relationships. So when it comes to you're facing those relationships and struggling with your partner or that family dynamic, couples or family therapy can help your communication improve and build stronger relationships and those connections. So overall, we talked about, like I said, those different segments of therapy that is going to be able to help you figure out what style is going to be useful for you. So I want to jump into our part when it comes to how to choose the right therapy for you. So tune in. So we talked about, like I said, those different therapy modalities. So a question that you may be thinking right now is, what is one of the best therapies for me? What's going to be beneficial for me? So I want you guys to keep in mind these three things, right? So self-reflection. So I want you to think about what you want to achieve. What is your goal? You know what I mean? So are you focused on healing your past trauma, or do you want to change your negative thoughts, or behavior? So really understand what is your goal when it comes to seeking therapy. So self-reflection. The next is going to be reach in, reach out. So I want you guys to reach each modality that we talked about, talk to your therapist and consider, have those considerations of which one may be the best for you. What are you trying to seek, right? So many therapists are trained in multiple approaches and can help you choose the best fit for you. And there's specific therapists that are catered to one specific thing because that's what they love to do. This is what they're good at, and they have a great focus in that. So make sure you're finding that research and reaching out to different support systems to really figure out which is the best fit for you. The next is trial and error. So I want you guys to take into consideration good things take time, but at the same time too is don't be afraid to try different therapies. It is okay to take some time to figure out what's the right fit for you, but like I said, good things take time, and going through this process of change is difficult, but once you get through that hurdle, that stage, and you're making that active and that consistent progression, things will get better. Like I said, self-reflection, research and reach out, and then trial and error. So things will take time and things will get better. So overall, like I said, we talked about different modalities, different therapy styles that are going to be able to be beneficial for you. I want you guys to realize that when it comes to therapy, it is important. Mental health is important. Take care of your mind, take care of your body. But like I said, this is going to be a journey. And overall, we're here for you. I'm here for you, and things will get better throughout time. Please take care of yourself. Get yourself a therapist. You know what I mean? It is essential. Your mental wealth will improve, and trust me and believe it will be worth it. But thank you for thriving me. Thank you for talking with me. See you on the next one.